Acquired factor 8 and 9 clotting factor deficiency in women is very, very rare. Hemophilia, as such, is a rare disease, but affects male due to X-linked inheritance pattern. But acquired hemophilia can affect both men and women equally. Typically, in the middle age or the later part, still it is very rare in women. But I will say again that yes, the girls and the women can bleed too. Recently, my sister, who is 75 years old, had some dental treatment, and after that, she started bleeding, and her hemoglobin from 12.8 came down to 4. While congenital hemophilia is a rare in women, acquired hemophilia is also uncommon, though perhaps underdiagnosed due to the misconception that the women do not have hemophilia. Women with mutations in factor 8 and factor 9 genes can have bleeding symptoms, sometimes as severe as seen in males with hemophilia. Suspicion can be raised by getting the PTA, PTT, and INR. Their symptoms are usually unexplained and excessive bleeding from cuts, injuries after surgery, especially after dental work. They have easy bruising, many large or deep bruises, prolonged bleeding after vaccination, nosebleeds without known cause, longer than 10 minutes, bleeding from cuts or injuries longer than 5 minutes. They can present as a heavy periods. Bleeding after childbirth is known in such cases. Women who carry hemophilia genes are at risk. They have pain, swelling, and tightness in joints due to bleeding in the joints, which is called hemoarthrosis. Although this is less prominent in acquired hemophilia compared to the congenital hemophilia. In severe cases, people can have a deep internal bleeding into the throat and the neck. While specific epidemiological data for acquired hemophilia in women in India might be limited, the general principle of diagnosis and the management are applicable. Diagnosis, the clinical evaluation is the history where you can find there is a bleeding symptoms after trivial surgery. Coagulation studies show prolonged activated partial thromboplastic time, APTT, gets prolonged, and that does not get corrected upon mixing with normal plasma is a key indicator of the inhibitor. Factor assays, low levels of factor 8 and factor 9 activity confirm the deficiency. Inhibitor assays, Bethesda assays quantifies the level of inhibitor. Genetic testing may be considered to rule out congenital hemophilia, especially if there is a family history. As for the management is concerned, the management of acquired factor 8 or factor 9 deficiency has two goals: to control the acute bleeding. Bypassing agents are recombinant factor 8 and activated prothrombin complex concentrate, APCC, are the first line of treatment. Antifibrinolytic agents such as tranexamic acid can be used as an adjuvant therapy, especially for mucosal bleeding eradicate the inhibitor, that is by immunosuppression. The primary goal is to eliminate autoantibodies. The first line of treatment often involves corticosteroids, prednisolone alone, or in combination with other immunosuppressants like rituximab, 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 or cyclophosphamide. My sister was investigated. She was given antifibrinolytic agents, no relief. Then she was given corticosteroid in heavy doses. Again, we found that the APTT improved, and then she is getting immunotherapy. She has had two therapies of rituximab, a monoclonal antibodies targeting B cells, which produces antibodies, has shown effectiveness in inducing remission, sometimes used as a first-line therapy, especially in patients with specific inhibitor titer ranges. Cyclophosphamide and alkylating agents used to suppress the immune system, often combined with corticosteroids for more aggressive immunosuppression. Other immunosuppressive agents like azathioprine, cyclosporine, or high doses of intravenous immunoglobulins can also be considered. As far as relevance to our country is concerned, I will say that as condition is very, very rare in women, hardly anybody knows the things. Even in centers which are dedicated to hemophilia, people have not had much of experience. I can say that, for a diagnosis and for treatment, multidisciplinary care is required to approach such cases like involving clinical hematologist, gynecologist, dental experts, and other specialists. A hemophilia treatment center can facilitate this coordinated care. I should say that much research is needed in this particular area. I have a very small experience of my own sister, which I've just now told you that it was a grave emergency, and she required hospitalization in the ICU, given blood transfusions, and then very slowly and this thing, the diagnosis was made, and now she's had two doses of immunotherapy, and two more things are planned. We are crossing our fingers that that kind of recurrence of bleeding does not take place.